partnership like way with VICSERV NDIS as we transition to the NDIS. I think it's immensely important as a wider sector. It's all subject to the vagaries of the NDIS, which we heard from you about just a minute ago. It's tremendously important that we identify together those issues which bring us together and which we can work on better together. I want to acknowledge the traditional owners of the land in which we are meeting and to pay my respects to their elders, past and present, and the elders of other communities who may be here today. I'm taking it as a given that you've all been here for the whole day and I haven't been, that there is little point in basically taking them through the basics of the NDIS. The people here have perhaps sadly forensic understanding of the National Disability Insurance Scheme and how it was established, its development, how much it's funded for, etc., etc. What I'd like to do, with your indulgence, is to instead talk about some of the key issues that have been identified so far by providers of the barn trial sites and trial sites around Australia and their clients, people with disability, families and carers, with a view to perhaps providing a picture of some of the outstanding issues to be resolved by us working together with VICSERV NDIS in concert with the NDIA. Lest it needs to be said, there are 7 trial sites around Australia, some of which commenced in July 2013, some of which commenced in July 2014. In both instances, it's only fair to observe, if no one has yet, that the rollout of the NDS as a trial proceeded at warp speed. And that's presented some challenges for the sector, for those seeking to provide services under the NDIS ever since. From the time that COAG endorsed the establishment of the scheme at the time it was first rolled out in Barwon in July 2013, it spans a period of about 12 to 15 months, which I'm sure you'll agree is a very, very short time frame in which the rollout of the scheme, which has been described in some quarters as the biggest social policy initiative in Australia's history, without exaggeration. So up there you've got a picture, a pictorial representation of the trial sites and where they are. Everywhere except Queensland, the trial site, and Queensland, for instance, is now moving to full scheme rollout earlier than others in Charterstown, Palm Island, and a couple of other places, in Townsville, I should say. In terms of the full scheme rollout and the phasing of that rollout, this diagram is intended to present you with a picture of what rollout will look like from July 2016. It will be no news to anyone in this room, I'm sure, that rollout actually commences here as of 1 July 2016. It's fair to say, I make this observation about knowing what other conversations have been had, that there is a mixed view amongst some of our providers in the northeast metropolitan area. Some of you will be saying, I wish we had another year and a half in which to get NDIS ready. Others of you will be saying, as you said to me, I'm glad that we're going 1 July 2016 because if we have to wait too long, others will take our clients first. Welcome to the open market for disability services, I suppose, is part of the message. So essentially then, my brief is to talk about some of the issues that have arisen in the NDIS trial site to date. And I by no means suggest that this is an exhaustive list. In fact, since I produced this slide, a couple more have come to light, which I'll talk about very briefly. So there are challenges and opportunities in the NDIS, but the challenge is not insurmountable if we're working together, and the opportunities are there for the taking for a sector which, lest we forget, has been doing this type of work for a long time, and experience counts in this space, but I suggest that. Amongst the challenges, and I know we're going to have a panel discussion shortly, so I'll make it reasonably quick. I'll go through some of these. The prices for services under the NDIS are at best lean. And that's a function of the fact that when the prices for services under the NDIS were first discussed, it was in the context of the NDIA intending to be a price taker. That is, it was going to accept the price thrown up by the market for the services being provided. And then about 6 months prior to the rollout of the trial, the NDIA changed its mind and decided to be a price maker. So we had a bit of a paradigm shift, which has resulted in prices in the trial sites, a number of you can attest this better than I can, not really allowing for representing challenges in terms of the provision of quality services. Dealing in specifics, the price for NDIS services in the trial site doesn't make any allowance for the cost of training, leadership development, back of house, IT, marketing. This in the context of development of an open market where all providers will want to be marketing themselves. They're just some of the, I'm not reading the notes on that one, they're just some of the most common complaints from and concerns raised by provider members in the trial site. But the price doesn't at this stage, for many services, recognise the true cost of doing business even on a break-even basis. Problem. We need to work together to resolve that, and we will. The role of the NDIA in the new market for services remains open to discussion and question. The NDIA in public statements has said that it regards itself in terms of the new market for services as an entity which will facilitate and monitor the new market. I challenge anyone in this room to actually define what that means in the context of this new market for services, other than to play a fairly hands-on approach to the new market. So what are the implications of that be the agency's approach? What is the agency's response? And these are questions which at the moment we're still seeking answers for. What is the agency's approach if new players into the market decide to run loss leaders for a period of time? Or undertake other forms of, if you like, rogue market behaviour? Does the NDIA have a role in that space, or is that going to be left to local consumer laws? Or some other form, some other regulatory body? These are challenges. Clarifying how mental health under the NDIS will be supported. I'm not going to patronise this audience by going into that in any detail. I've got no doubt you've discussed today some of the challenges for the community mental health sector vis-a-vis the NDIS, and I know you'll be working through those. Supporting clients and their families to be sufficiently confident and empowered to exercise their rights. We all know that in this sector that the people with disability have understood for far too long that funding for disability services has never been second level support demand. And as a consequence, people have always gone without. And as a consequence of that, when people with disability have been offered something, anything, sometimes that has been enough. This is a scheme which is an entitlements-based scheme. But when a person, in an ideal world, once its ideal version comes to fruition, this is a scheme which is intended to tackle clients with disability, tell us what you want, tell us what you need, within a framework of decision making, you'll be entitled to access that. So part of our challenge is to support people with disability, families and carers and others to understand that this is a scheme where the statements like I want and I need are ones which are appropriate. And we've seen the trial sites after about a year and a half or so, and a couple of plans people with disability have been starting to understand this new paradigm, and that's fantastic. There's an ongoing issue regarding disability and housing and accommodation issues, how we actually reach a critical mass so as to truly deliver on this promise that the NDIS holds out for people with disability of choice and control in regards to accommodation and services provided within. That remains an ongoing discussion, which is possibly a long way from resolution, although our bilateral agreement with the Commonwealth indicates that a framework for the development of policy around accommodation must be settled by governments, Commonwealth and state by the end of this year. I'm sure that all of us in this room, through our people organisations, and perhaps directly in some cases, look forward to being part of those discussions to the extent we can be. Managing the specialist and mainstream interface between, in this case, specialist disability services and for taking on so much hypothetical example during the trial, health services. Making that seamless, making that work, that remains a challenge. And lest we forget, there are a whole suite of industrial relations and workforce issues which remain to be resolved, not least amongst them being that this is a sector which certainly in terms of disability basically is covered in Victoria by 5 different industrial instruments, and yet the price for services under the NDIS assumes that everyone's covered by the modern award. There are people in this room who will be receiving wages and conditions quite significantly more generous than those provided for under the modern award. How do we make that work in the context of those lean prices for services I was talking about previously? So, we've broken that habit quickly because I'm normally glass half full and start off with glass half empty, but let's move on to now the opportunities very quickly. First of all, very quickly, funding's gone up by 300%. That's got to be an opportunity in anyone's books. We can't do something with that amount of funding, perhaps not trying hard enough, but we'll see how we go. portability of supports, and the fact that people with disability will be able to take their packages anywhere in Australia. That in turn will hopefully promote conversations across borders for us about the things that we have in common and how we can do things better together. The focus on data and evidence, I think, is a positive in terms of supporting our sector over time through the good agencies of the NDIA to understand what's working and what isn't. So on an evidence base, we can say we're going to stop doing that and start doing that instead. I think that's an opportunity. Mindful of time, I'm just going to quickly just flag some things that are coming up. Obviously, we've got the rollout of locations under Victoria and New South Wales, and betting is that Tasmania will be next. We're expecting an operational plan to clarify various issues in the bilateral agreement with the Commonwealth to be released by Victorian and Commonwealth governments by December 2015. I've already referred to the accommodation timeframes. We're looking forward to the resolution of issues around what a consistent safeguards and quality assurance framework for the NDIS will look like, and as expected to have by early 2016. As if we need more evidence of it, peak organisations such as VICSERV and NDS will be running programs of information, as will the Victorian Government, to support the sector in its transition. And finally, there's a couple of other things that, if you like, hot off the press, one of which is the ongoing discussions around the ILC framework and the fact that there's a consultation process that ends at the end of October. Also, those of you who are students of the NDIA's website, I'm not sure how many of those of you will be in the room, may or may not be aware that in Victoria, it's quite a specific Victorian tender. The NDIA put out yesterday a tender for local area coordinator services in Victoria for a period of 3 months. Yes, and some of you are looking quite quizzically now and quite interestedly, I hope. So that tender document, which I understand runs for about 97 pages, is on their website. They're pretty keen to get to tender for that work. It's also true to say on one reading of the tender document, if you're a disability service provider, you may not be able to tender without doing some bits and bobs with your corporate structure. We're following that up with the agency directly in terms of whether or not it was intended or by accident. Apropos my earlier comments about things proceeding at warp speed. So that quote there is a genuine quote. The quote that's down the slide comes from the father of two NDIS participants in Darwin. And I think if nothing else, what that quote does is speak to the value of people with disabilities, their families and carers, and placing upon supports they're getting under the NDIS and what it's meaning for their lives. This guy basically was this guy was found the victim of a ration system, which we have in Victoria and every other state and territory, where although they had entitlement, they couldn't get access to anything. Amazingly, under the NDIS, under an entitlement-based scheme, his life changed, and more importantly, the life of his children changed for the better, just by reason of being provided with a plan and a package. And he was fair in. I was having a chat to him at the time, and all of a sudden he just opened up and started telling me how this amazing life changed. So I suppose, having started off on the negative and come down the other side of the positive, can I just say, if we do nothing else with this in our engagement with the Commonwealth and with the NDIA and with the NDIS, it's tremendously important to remember that for all the pain and road humps that we're going to face into getting a scheme that is worthy of people with disability in this country, there are people already benefiting from it, and it involves all of us making sure that everybody else does as well. Thank you.
Thank you, David. John, I want to ask you to come and just close down this while Brooke comes and makes her way up. And just while we're doing this transition, for those people who are joining us on the panel, would you mind making your way up now to the front so we can just keep rolling? So, VICSERV has moved and briefed the implementation of the NDIS in Bar. She's an outstanding leader in our patch, and she's going to give us some of her reflections about the impact that this change process has had on the workers in Darwin. So please welcome Brooke.
So look, my name is VICSERV. I'm the manager of service development from Pathways, and I'm actually going to be talking to you about something quite different to what we've heard today, and it's in relation to the worker experience. And I'm absolutely delighted to be able to share with you my research study that I conducted late last year as a part of my master's requirements. So the research study really examined the professional and personal impact that the NDO transition had on frontline support staff involved with the transition process. This presentation really, trying to jam it into 10 minutes, really isn't a thorough account of the research report, and if you are interested, you're able to download that off the Pathways website. But I also just wanted to set the scene and acknowledge that when I conducted the study, it was really at a central point in time for mental health providers. It was right towards the end of the transition process, so as you would imagine, it was very heightened, were quite stressed with the transition process. So just to keep that in mind when you're hearing the stories today. But on a more positive note, I'm actually quite I'm privileged to be able to share with you some of their stories, as often when reform and welfare reform takes place, it's often never reported or little reported from the perspective of direct frontline support workers. So here is their story. I do want to concentrate a little bit. I'm going to spend a bit of time just talking to you about the research design. And certainly, it was a small scale study, only 7 support workers from 3 of the 5 mental health providers participated. All of the support workers had a diverse range of experience from psychology, social work, community welfare and key work, and had been working in the sector for 3 to 20 years. So there was a broad range of experience. So look, that's technology. So look, the findings of my study was really characterised into 5 themes, and sub-themes did arise from the data. And certainly what I found is that the workers were talking quite consistently and regularly about similar themes and issues, and most likely research saturation has been achieved. So the first issue that I found was role conflict and role ambiguity. And workers agreed that any changes to their role had created conflict, and they were challenged to keep within the parameters of the new funding arrangement. Workers discussed giving more in their role that was actually funded by the NDIA, and they now have started to talk about that they weren't working with people in a recovery-orientated and holistic way. Workers stated it's compensating a fully designed system and achieving is what we do. Workers talked about that some of the NDIA staff actually they felt they didn't understand the role of the mental health sector, and certainly didn't understand their role as support workers. And workers talked about a fear of being questioned by NDIA staff when they were found to support people outside of what NDIA viewed as reasonable and necessary support. So one of the workers talked about a situation where they were supporting their client to attend an NDIA planning meeting. The client informed the planner that they were to help them address issues with their partner. The planner questioned the worker and accused them of blurring their role and being a family counsellor. So the role conflict was really described in the context of service users who had a significant increase in support hours in their plan. And whilst it's acknowledged that people having an increase in support hours is an excellent outcome of the scheme, some of the workers were quite challenged in this because they found that people they were working with had an increase of 2 hours to 10 hours of support a week. And what they had feared is that potentially these people were being over-serviced and creating worker dependency. So the second theme that came through was work stress. And the focus group really clearly did demonstrate that the NDIA's practice changes had intensified the work environment. And workers had described stressful work situations, ethical challenges, and conflict that they were being faced with. So workers described the supports were not really in line with community mental health providers and the practice principles that align with their organisations. And workers described feeling anxious at pressured, on edge, and ready to snap. And over half of the workers talked about feeling that they might be facing burnout if the NDS transition continued in the same speed and demand that it was having on support staff. What came through with the stress for workers was generally around the eligibility process that we've heard about earlier on today with the NDIA, and many workers felt ethically challenged by the NDIA transition process and having to prove to get people through the scheme. Some of the support workers talked about the outcome star and that they'd use the outcome star as a way of transitioning people and determining their functional capacity. And one worker stated that prior to the NDS, they'd used the outcome star in a strength-based client directive tool. But for the purpose of the NDIA, they needed to have deficit-focused conversations about areas in their life that they needed more support, and ultimately so they could look worse on paper. So a story was given by a worker whose client had been doing really well for some time, and during the NDIA transition process, they really needed to talk about the areas in their life where they needed more support, and to take this person back to that time when they were quite unwell. And the worker talked about being quite upset about this conversation, and the client was distressed and asked the worker, "Is this what you think of me?" So theme 3 was worker challenges and practice demands. So the lack of process and consistency from NDIA, loss of professional respect, language barriers, and disjointed work practices were topics discussed by workers. A common issue was the lack of collaborative practice between NDIA and the mental health providers. Workers used phrases such as disrespected, minimised, and demoralised in describing accounts where they were in NDIA planning meetings and they were professionally challenged by the staff. A worker described an incident where an NDIA staff member put their hand up to their face and told them not to talk. Another NDIA worker said, "Be quiet and we don't want to hear from you." Workers stated that this really did challenge them, as they thought that advocacy was a big part of their role in ensuring that they were able to ensure that people could have the right supports in their life and in their land. Workers did acknowledge, though, that as the NDIA transition process had evolved and changed, that their relationship with NDIA staff had improved, and that was really important to them. Workers described that the NDIA support was being disjointed, where they are trying to separate people into boxes. One worker debated the NDIA support item as arguing, we are integrated beings, and we are forced to treat people in a disintegrated way.